Hi, everybody. I'm so glad to join you today. I want to thank Stacy Stewart and the March of Dimes team for hosting this event and for your ongoing work for moms and babies. Stacy, thank you for all that you do. And to everyone watching, thank you for being part of this important conversation. The past months have been profoundly difficult for our nation and for Black communities in particular. Black Americans have been killed by police officers. Black Americans are dying at disproportionate rates due to COVID-19. And as all of us know, Black moms continue to lose their lives in the midst of our nation's ongoing maternal health crisis. This pandemic is not only shining a light on the racial disparities that have plagued our society for centuries, but it's worsening those inequities. On June 26th, the Centers for Disease Control and Prevention reported that Black and Hispanic pregnant women appear to be disproportionately affected by COVID-19 during pregnancy. These findings are an extension of other trends in coronavirus data that exist nationally and in my state of Illinois, where Black people make up less than 15% of our state's population, but nearly 30% of our state's COVID-19 deaths. These racial gaps are glaring but not surprising. Many of you are already familiar with the disparity statistics and maternal health outcomes. The United States has the highest maternal mortality rate in the developed world, and it's not improved over the course of my lifetime. For as dire as the situation is overall, it's even worse for Black women, who are 3 to 4 times more likely to die of a pregnancy-related complication. And Black women are twice as likely to lose an infant to premature death. Just as there are parallels between COVID-19 and maternal health outcomes, there are also similar explanations for the cause of these disparities. For example, we know that unequal access to care is a cause of racial gaps and maternal health outcomes, and it was also identified as a driver of COVID-19 disparities by the National Institute of Minority Health and Health Disparities. Other factors that are contributing to inequities in COVID-19 outcomes include discrimination in our healthcare system and unequal distribution of scarce medical equipment and supplies like testing resources. We also know that racial and ethnic minority populations are more likely to suffer from an underlying comorbidity like diabetes, cardiovascular disease, or asthma, conditions that are oftentimes driven by social determinants of health like food insecurity and environmental threats. In fact, a recent study published in JAMA found that climate change is linked with serious risks in pregnancy and that Black moms and babies are suffering the most. Identifying these trends are important, but we also need swift and serious action to improve outcomes and promote equity. We will need targeted interventions informed by comprehensive data collection that's stratified by relevant demographic characteristics, including not only age, sex, and geographic location, but also race, ethnicity, and pregnancy status. I'm grateful to the March of Dimes for their partnership on the bipartisan letter that I led with Congressman John Lewis, signed by 62 members of the House, requesting that Secretary Azar take all available steps to adequately understand the unique risks and effects of COVID-19 during and after pregnancy. In order to take appropriate steps to protect pregnant and postpartum women from COVID-19 risks, we must gather a stronger evidence base to inform future policy. There are also existing policy proposals to improve maternal health outcomes that have become especially important in the midst of this pandemic. Starting with the critical issue of access to care, we need to ensure that Medicaid coverage for pregnant individuals extends for a full year after the end of a pregnancy, instead of cutting off at 60 days. My colleague, Congresswoman Robin Kelly, has been working tirelessly to ensure that the needs of new moms can be met for the full duration of the postpartum period with legislation like the Mamas Act and Helping Moms Act. These bills are especially important now when the risks for pregnancy-related complications associated with postpartum coverage gaps are exacerbated by this public health emergency. That's why it's so significant that the Patient Protection and Affordable Care Enhancement Act, which we passed out of the House of Representatives on June 29th, included a requirement that every state, extend postpartum Medicaid coverage to 1 full year after delivery. But we can't stop there. In March, I introduced the Black Maternal Health Momnibus Act, which builds on existing legislation to comprehensively address every dimension of the Black maternal health crisis in America. March of Dimes has been an invaluable partner in developing these bills, and they're now even more important in the face of this pandemic. For example, the Moms Matter Act, which was sponsored by Congressman Joe Kennedy and has 3 Republican co-sponsors, make investments in maternal mental and behavioral health. Programs to promote maternal mental health are particularly necessary during COVID-19, a pandemic that has already led nearly half of U.S. adults to report negative impacts on their mental health due to worry and stress over the virus. These trends are especially troubling in the context of childbirth. Even before the pandemic, maternal mortality review committees, which examine pregnancy-related deaths in their respective states, found that mental health conditions are one of the leading causes of pregnancy-related death. And we know that Black women experience higher rates of maternal mental health conditions and lower levels of access to treatment. The Moms Matter Act makes critical investments to address maternal mental health disorders with a particular focus on the challenges facing Black mothers, expanding access to supports that pregnant and postpartum individuals will need during this public health emergency and beyond. Other provisions of the Momnibus are even more important during COVID-19 as well, ranging from support for community-based organizations like the Kira Johnson Act to workforce investments in maternity care deserts like the Perinatal Workforce Act. That's why I'm committed to working with my colleagues to advance the Momnibus this Congress, and we won't be able to do it without you. Since the first case of COVID-19 in the United States, more than 1 million babies have been born. As we continue to battle this pandemic, moms will continue to give birth, so we don't have any time to wait. Now's our moment to advance legislation like the Momnibus and the 12-month postpartum Medicaid coverage. Please reach out to your members of Congress, spread the word on social media, and continue to host important events like this one. We can't stop until we pass the policies that will ensure that moms and babies can access the care, support, and social services they need and deserve. Thank you for doing this work alongside us. And thank you for the opportunity to speak with you today. I look forward to the opportunity to be back together again soon. But in the meantime, take good care of yourselves. Bye-bye.